Hi, I'm Dr. Corey Rich, Executive Director of the Phoenix Recovery and Counseling Centers. If you're watching this video, you or someone you love is dealing with the challenges and the pain associated with chemical dependency. Despite best efforts and intentions, the heartache of struggling with chemical dependency may still persist. We are very sensitive to what you've experienced, and we're aware of the difficulties that come with addiction recovery. That's why we carefully assess and place our clients in the best and proper level of care. It begins with residential treatment and traverses across a day program, intensive outpatient program, to general outpatient programs, and finally, the continuum of care culminates in an alumni support meeting. During each level of care, the Phoenix Recovery and Counseling Centers support the development of recovery capital, a form of education and skill development to aid in sustained recovery. Before treatment can occur, it's important that we properly assess you or a loved one. With chemical dependency, the assessment identifies 5 criteria to help you determine what level of care is needed and serves you best. These include tolerance to chemicals, withdrawal symptoms, ability to regulate use, changes in lifestyle due to drug seeking, and persistent use despite negative consequences. Additionally, all patients are assessed for current degrees of stress and life circumstances, social support, access to care, and other issues which are critical to understand in order to provide the best and highest standard of care. Our standard includes 6 levels of care progressing from residential treatment to our monthly alumni meeting. Keep in mind, all levels of care focus on the understanding and application of disease management principles and increase the ability to define and pursue a meaning-based life. Interventions and clinical experiences also focus on spirituality, mindfulness, coping skills, emotional regulation, and neurological healing required from the effects of trauma and mental health disorders. Residential treatment is a live 24/7 experience. The primary objective is for the patient to stabilize due to post-acute withdrawal from drugs or alcohol. Stabilization is achieved through medication-assisted therapies, introduction to disease management skills, as well as the beginning efforts to identify meaning and enlist the choice system to pursue meaning fulfillment. The Phoenix Day program provides 21+ hours of clinical support through group and individual therapy over 5 days a week, 4 to 5 hours a day. This clinical support begins to establish a firm foundation for mental health stabilization and recovery capital. Medication-assisted therapies are utilized as needed to further stabilize and assist with mood or anxiety concerns. Once the program is completed for the day, the patient returns to their day-to-day activities of a meaning-based life. The intensive outpatient program provides 9 hours a week of clinical support through group and individual therapy over a minimum of 4 days or nights a week. The program has group options for both day and evening hours so patients can maintain their day-to-day activities. Clinical support provides disease management skills as well as help patients understand the application of life skills. The general outpatient program is exactly like the intensive outpatient program in providing group and individual therapy, disease management skills, and the application of life skills, but attending for anything less than 9 hours of individual or group therapy. In addition, we have an outpatient program that is characterized by clinical support through individual sessions, but no attendance in groups. Individual sessions are typically 1 hour long, 1 or 2 times a week. Finally, we offer the Phoenix Alumni Meeting exclusively for our former patients once a month. Alumni share their success with those who are practicing and enjoying recovery and their pursuit of meaning. This meeting also provides support and fellowship, which is vital for Phoenix alumni. These 6 levels of care, including the understanding and application of disease management principles and developing a meaning-based life, are what separate the Phoenix Recovery Centers from other treatment programs. It is our mission to empower individuals and families suffering from addiction and mental health disorders. At the Phoenix Recovery and Counseling Centers, we celebrate life with our patients and their family members through lasting solutions.